VA is synonymous with wait times, but efficiency is the word of the day. Do you think it will help?
Will you commit to doing what's right for the veteran when it comes to the personnel that are handling these people? We can talk about acts and laws and bills and all this. It ain't gonna make a damn bit of good unless we get the people that's running these VAs and these homes that take care of our veterans. We don't get the best. Will you commit to that?
Senator, thank you for that. I mean, your last day was not just your profession, but I think every other profession in the world expects accountability. And I think that's what raises the standard. So yes, we're going to have accountability. The VA Accountability and Whistleblower Act, which by the way, passed unanimously out of the Senate, its intent was to make sure that those workers who were not fulfilling their mission, they were not going to take a job anymore. I intend to make sure that this is a promise that I have, is that if there is someone who is harming or in the way of our veteran and taking a veteran's benefit away, I have no problem in getting rid of that person and making sure we do it properly. And I have no problem with the legal repercussions of that, because there's no one at the VA going to stand in the way of a veteran getting the care properly. And if they're not doing it safely, which we saw many of those were not doing it safely and putting our veterans in harm's way. But I will say it again, and I think you would agree with me. I will be the biggest cheerleader for every VA employee out there who is out there getting up every morning, doing it right, making sure we're taking care of our veterans. But I believe the only way I can make them better, the only way I can push them, is to not allow those not to do it. So we have to have that accountability. This body passed it unanimously. It is about raising standards. It's about saying that we're going to expect the best and we're going to require the best. Because if I want to retain doctors, if I want to retain nurses, if we want to retain benefits people, then you got to set a standard that says, I'm proud to be here. And for me, I want to lead an agency that works and puts our veterans first and holds accountable those that have not.
There are massive staff shortages in the VA, and I am concerned about the hiring freeze that President Trump has initiated. Will you stand up publicly and say, you know what? We need every VA health facility in this country to be adequately staffed. We will not accept staff shortages, and make sure that we have the people that we need.
I will advocate to make sure our veterans are taken care of, but I'll also support in the fact that we'll take a look at the current levels of employees that we have and where they're properly located, and we'll work at that, and the President will work under the executive order that he has given.
Look, in English, we all understand this. There are inefficiencies in the VA. There's waste in the VA, every government agency. On the other hand, the VA in general, in my view, does an excellent job. They need the support.
Yep.
So you want to go after waste and inefficiencies, do it. But make sure that we have the quality of doctors, nurses, staffing that we need to take care of every veteran in this country.
Thank you, Senator.
So you made a comment about it was important to get the right people doing the right job, and I agree with that. And as we have been overseeing the VA, something that has been a consistent problem is the return to work policy and the lack of individuals that are working full-time. At one point, out of VA benefits, they were only required, according to Secretary McDonough, they only had to work in person 2 out of 10 days. And then in healthcare, they had to work in person 5 out of the 10 days. So that is a problem. And I fully believe that's why the backlog, as you mentioned, that long-term backlog is at 265,000. If you put those that are under 120 days on that list, you are at 956,000. This is because people don't go to work. So where are you on that and having that return to work policy?
Thank you, Senator. It's good to see you. It's also good to see you back over here as we've worked together many times. And I do pride myself, as I mentioned in my opening statement, about the stuff that we worked on bipartisan, Music Modernization Act, which you are such a great champion of as well. And we're going to have to work together on this. But I do believe people need to come to work. The President's made it very clear. He made that very clear that people need to come to work. Now, there are certain issues and times, and before the question is asked, that we have a large portion of the VA workforce is unionized and they're in contracts, but we're going to work together to get people back to work.
What percentage of those employees are union?
80. Approximately
80%.
80% of 470-ish thousand.
Okay.
And some of them in the telework agreement stuff, look, we're going to encourage them to come back to work. We're going to follow the president's directive in that, and we're going to make sure that we get people in there, because at the end of the day, it's about veterans. My hospital employees, if I was confirming this, they have to show up every day.
Okay. That is encouraging, because you look at we've talked about the health records, the EHRs, and the fumbling, the $15 billion that has been spent on that not to have those records. The way there is no data transfer from DOD to the VA on those health records. This is a problem we can fix. We've got a lot of good health IT experts in Nashville that could fix this. And when they hear from people that are in the VA system about they can't get any care, the wait times, and we've talked some about the backlog. At the Fort Campbell facility, VA facility, the wait to get a primary care appointment today, and we've just checked our numbers, is 81 days. And in Chattanooga, it's 110 days. In Murfreesboro, it is 54 days. That is completely unacceptable. And if people are going to not show up to work, if they're beholden to the union and say that it is about them and not about the vet, that is something that is just completely unacceptable, and it's one of the reasons we need to strengthen community care. The suicide rate, that 34.7 individuals per 100,000 of our vets that choose suicide, the mental health components, and having that community care where they can access it in their community without having to travel, having an EHR that they are carrying with them to the doctor, that will be helpful.
Senator, you've hit a multitude of things there that are all important to the very end and aspect, and that's the health and safety and the wellness of our veterans. The rec healthcare record system, I mean, there's nowhere else we can even point to. I mean, you cannot, if a doctor in the VA walked out and decided to go take a job in the private sector, guess what they're going to find when they get there? Electronic healthcare records.
That's right.
So the system that we currently use, it still is, F1, F2, it's unacceptable, because it creates what the problem that you've seen going forward. Look, I believe in all workforces, and I believe, that the employees at the VA, whether they're union or not, are very valuable, and I respect that. I was years ago, 5 years in the Food and Commercial Workers Union when I was in the Big Star grocery store. I get the issue, but also I believe we ought to bring people back to work, that we ought to make it in a way that people are not only employees, but at the end of the day, we remember it's not about the VA, it's about the vet.
Last night, the White House issued various executive orders. Some of them dealt with a federal hiring freeze, a freeze on regulations, and other issues. We're still reviewing them in my office. The issue of a workforce hiring freeze memorandum claims that it will not, quote, adversely impact the provision of Social Security, Medicare, or veterans' benefits, end quote. I'd like to know from you, what does that mean in practical terms about the employees who deliver veterans' health care or work in cemeteries? Does this language exempt all of the VA's positions from a hiring freeze?
I think, Senator, we're still, like you, examining that, but we support the president's initiative here in the freeze. But also, I take, as far as what it says, I'll take it at the words that's on the paper, and that's not going to affect it, because we have people doing those benefits packages right now. We have people working at that, and the implication would be that adding more people would fix whatever the problem is. I'm convinced right now that the workers and the benefits, we need to make better efficiencies with what we currently have. So I support that.
Yeah, that's not reassuring to me, because I'm asking not about the VA employees who work on benefits. I'm asking about the folks who are in the hospitals, in the care facilities, at the cemeteries. They're not dispersing benefits, they're providing care. And as you well know, there are extraordinary problems in recruiting and retaining the doctors, the nurses, and filling their ranks where there are openings right now. So the explicit language of that memorandum seems to include them in the hiring freeze.
Going by the way you've worded, I will say this. So hiring freeze in the wording that you use, and I do not have this before me, so I'm not going to comment completely on it. I do not have it in front of me. I'm going off of the memory, and we're still examining that as well. I can assure you President Trump is, in this executive order, is to get assessment on where we are with our employees. It is not to take away from anything that is currently there in future. And the way that your question is worded is implying that they would not be there to do the veterans health care, the cemetery work. That's going to continue. This new hire freeze is not there. We may not at this point bring in a new person tomorrow unless we need it, but this is where we're at. And I think what he's done is to get an assessment on where we are.
Well, you and I are trading a lot of words. Let me come right to the point. I'm asking you to fight to fill the openings, not a hiring freeze, in the ranks of the doctors, the nurses, the attendants, everybody who works in care facilities or in veteran cemeteries, rather than leaving those positions open because those folks are needed to care for veterans. Will you seek an exemption to the hiring freeze for those positions that concern veterans' care, including the Veterans Crisis Line?
I will take everything that you've said in consideration and understand that the freeze and export the executive order, while at the same time, if confirmed, be willing to make sure that there's nothing missing in the process. We may, as you said, we're sharing words. I think we're saying the same thing.
Well, no, we're not. With all due respect.
I respect that.
This is going to be a first test of your leadership. Whether you fight for an exemption in the hiring freeze for the non-veterans benefits employees who are needed to care for veterans at medical facilities and other places, including the Veterans Crisis Line, rather than have them covered by that hiring freeze.
Senator, I view this as not as a test of what I will do. I believe it is a test of two different assumptions, and assuming that just because there's opening, that there's an actual need at that point that makes a veteran miss their benefits of health care. I think we're coming at it from two separate perspectives. There may be openings, but there was openings yesterday. There was openings last week. This is simply looking at ahead to say where we're at this point. I think we're coming at this as two separate perspectives. I respect yours greatly. But I think what we're going to see is no one on the veteran health care side is going to miss their health care provider because of this new hire freeze. The president is doing a prudent step as he comes into office to make sure that we have a good handle on what we've got and going forward. I will always fight, Senator, and I've told you this in your office, and I'll tell you again here, for what we need at our facilities. But I'm also not going to fight for issues in which I believe that I've not had a chance to study and make sure that this issue is taken care of. I do not believe this is going to have the impact that you're having because I think we're coming at it from two different perspectives.
Well, I will just say, I don't want to get into an argument here, but there are possible openings where, let's say, the head of the West Haven VA facility says, oh, well, we don't need to fill that position.
Yeah.
But there are also openings where the director of the facility is saying, we need more nurses.
No.
We need more doctors. We need more mental health care. You and I have talked about this
Yes.
issue. You can't provide veterans health care without the people, the skilled professionals to do it.
I appreciate it.
And I hear you saying if there's an opening, it means that we don't need somebody for that opening.
No, I think, Senator, just a general reminder, last week, Secretary McDonough could have filled those positions. He chose not to, or couldn't find anybody.
Well, he may have wanted to, and you may have talked to him about it, but it's not easy to fill those positions.
And Senator, that's why we're taking a perspective of where we're at. And again, I appreciate it. We'll work on this together, but I respect what the president's done. I think it's a prudent step looking forward, and that the health care is not going to be compromised in that process. I support that.
You're going to be under tremendous pressure as we move into this difficult budgetary situation, and there's a lot of pressure to reduce the budget. I think has been pointed out here, the Veterans Administration is one of the largest pots of money in the federal government. it's very easy to focus on the bureaucracy, that term, which carries with it a kind of negative connotation. But I would point out that in many cases, staff cuts equal benefit cuts. Because if there's nobody there to answer the phone, or if the process is delayed to the point where the veteran dies or just gives up, that's in effect a benefit cut. So as you're under this pressure, and I believe you will be, I hope you'll take care to balance necessary efficiencies against the loss of services. You've said repeatedly, and you said in my office, and I love it, you don't want us to have to be advocating for our veterans because they ought to get their benefits without having to come to a congressional office. Well, if staff cuts end up having nobody answer the phone or answer the phone after only 100 rings, or say, we'll have to talk to you 6 days from now or 6 months from now, that's going to only aggravate the problem, and you're going to be hearing from us on a daily basis instead of every other day.
I think, Senator, your point is taken, and I understand. I think the interesting question is these very things arise right now at the staffing levels that we have. I think there's more of an issue here. Are we doing things as efficiently and processing as we can with the staffing that we currently have, whether that's more or less staff? I think sometimes you have to look at the process. I mean, why is it that we're back up at 250,000 backlog of benefits when we've had 130 billion in increase in funds and 70,000 employees? That's just something's broken about that.
I agree, and I commend you for wanting to follow up on that. And I have no problem with efficiency, and I think I can't complain about a hiring freeze. I actually signed a hiring freeze in my inaugural address as governor. So I understand that. On the other hand, I think the point that Senator Blumenthal was making, the hiring freeze should not apply to direct care workers. If my Togus Hospital in Maine needs a cardiologist and it's been open for a couple of months because they're hard to find, this hiring freeze should not prohibit them from continuing to search for, and if they can find a cardiologist, to sign them up. I hope you'll distinguish between direct care workers and others who serve veterans behind the scenes.
Thank you, Senator. If confirmed, we're going to always make sure that, as I've said many times before, no matter what the issue is, I will always fight for making sure our veterans are getting the care in the proper way that they need to.
One of the things that this is in the management aspect, and then maybe this is an issue or a challenge because of employment agreements, but it is not infrequent in which we bring a specific instance in which bad behavior, malfeasance, malpractice, insubordination, a list that could be long of errors and mistakes made by someone who works at the Department of Veterans Affairs in the field. And the response ultimately, if you ever hear about what happened to that person, that employee, is we transferred them to another hospital. That can't be reassuring, shouldn't be reassuring to anyone. And maybe there's some impediment that makes it can't be impossible, makes it difficult to actually fire someone. And the instances here are not like employee grievances. It's not like mismanagement in the sense of how do we get along here. These are egregious circumstances in which terrible things have happened to veterans. And the response is never you're out of here. At least that if that's the response, it rarely happens in the end. So my point, which I don't think I explained very well, but the point is there has to be a better disciplinary circumstance in those extreme cases other than you are transferred to another facility. And that is for the well-being, safety, and importance of the veterans who are served by the Department of Veterans Affairs.
Senator, I couldn't agree with you more. The concept of failing up is not a concept that I abide by. I'm a military person. I'm someone who's also employed people outside the government as well. But failing up is not an option. You don't fail up. And we're just because what we will do is I will work within any agreements, employee agreements, collective bargaining. But if you're putting a veteran health and safety at harm, I will make sure the department will get rid of you, and we are willing to do whatever it takes to do that. Because here's the deal, and I don't think there's any senator or congressman who will disagree. If that happens, you shouldn't be there. We'll do everything within the agreements to make sure their processes are followed. but I will not tolerate it. And that then in turn makes our better employees even better.
You highlighted that point, and I was going to compliment you on it, that a culture, a sense of well-being of the employee, that it's a safe and valuable job, and that you're doing good work is hugely important to the success of the Department of Veterans Affairs. And if other employees see that some employees get away with bad behavior, it diminishes the value and joy of working there.
Senator, I agree. There's an old saying that I ascribe to. There's two ones that I look at, and one will be on my desk if confirmed, and it says if it goes wrong, it's my fault. If it's a little bit okay, it's everybody, and if it's right, it's everybody else's, so we lift everybody up. But understand, when you have employees that come to work every day doing it right, and they feel like they have to carry a coworker along, after a while, they don't want to carry the coworker anymore. They just rose to the level. They go to that level. We're not going to tolerate that.
And that's a wrap up on today's deep dive into the VA Secretary's confirmation hearing. As we've seen, staffing challenges within the Department of Veteran Affairs took center stage, with tough questions about how the new leadership plans to tackle shortages, improve hiring practices, and ensure our veterans get the care they deserve. The big takeaway, the path forward isn't just about filling positions. It's about retaining skilled professionals, streamlining processes, and building a system that truly supports both staff and veterans alike. But what do you think? Will the proposed solutions make a real difference? Or is the VA facing deeper issues that leadership alone can't fix? Drop your thoughts in the comments below. We'd love to hear from you. If you found this breakdown helpful, give it a thumbs up. And don't forget to subscribe for more updates on the Senate confirmation hearing and issues that matter to veterans. Until next time, take care. Lenny B, out.